kudos on getting the naloxone out there and readily available. I had a young man in my office the other week who was saved by naloxone and is now living in recovery. So I think it's a wonderful program. Question that I have, and I just want to commend the administration of Washington, D.C. for continuing to provide us with increases in funding. It's much needed on this front. In DDAP has implemented a voluntary resource for substance use professionals to communicate the availability of beds in treatment. Yet I still hear from our local SCAs and from folks that are looking for treatment that they have to wait. So they want to get into treatment, try to develop warm handoff programs, but yet we can't find available beds. We can't find the treatment that they need. And unfortunately, there have been deaths related to the fact that people were waiting to get into treatment. With that said, we had a bill that had passed the House unanimously regarding a bed registry. Currently, there is PEMA has a bed registry that is used for emergency services. And it's also used for long-term care. And also, there's programs that are available through the PDMP to provide that type of information. What we're hearing is twofold. One is that in rural counties like Carbon County, we have no outpatient providers other than our SCA, doing the best they can. But we have no outpatient providers. We have no inpatient. So people are having to travel an hour to get treatment. So the question is twofold. What can we do to better utilize the programs that we have right now in PEMA? And we've had meetings with your staff in regards to that. And if you would send a letter, because the federal government seems to be very supportive and wanting to combat the opioid epidemic, could we find out from the federal government whether we could utilize that program to enhance a better bed registry to get people that need treatment into treatment right away, since the money is there and people are dying while they wait for treatment? And secondly, how can we better, what can you do from the department to better serve the rural counties where we have no outpatient providers to come in? So those are my two questions.
Yeah, thank you, Representative. And I want to say that I appreciate your tireless efforts in this space, truly an advocate. And I really appreciate that you're willing to work with the administration in terms of crafting legislation that you think will be very helpful to people. So I want to address the question in sort of a slightly different manner, which is to really get at the bigger issue of capacity. So bed registries are a nice thing to have for where there's an abundance of capacity and folks are just looking to locate where that capacity exists. I think from our perspective, the bigger issue is that folks are on wait lists because there aren't necessarily providers in their area that are offering services for the type of insurance that they have. So the really big issue in Pennsylvania is that we've got providers who, for financial reasons, have capped the number of individuals that they are willing to accept who are publicly funded, whether that's medical assistance or whether that's funded through our block grant dollars. And so some of the things that we're needing to work on is making sure that we're providing adequate reimbursement rates for those providers so that they can begin either raising or lifting altogether the caps that they have for individuals seeking treatment who are publicly funded clients. And so, the need for a bed registry sort of runs even deeper than just locating where facilities are. I think that's the easy part. The hard part is locating and building capacity for the individuals based on the funding source that they're utilizing and making sure that it's in close proximity to where they live.
And I would say that having a bed registry that would complement that, and from what I had seen of the bed registry that PEMA already has, there are categories where we could list what type of insurance would be acceptable to those facilities. I think we also need it, direly need it for mental health. I mean, there's so many people who have a dual diagnosis, and people are sitting in emergency rooms sometimes 7 to 10 days in an ER, getting no treatment at all, and driving up the cost of everything because they don't have a way to find those beds. So I look forward to continuing to work with you, although it's been frustrating. I know the bill is over in the House. I would really like to see that letter to the federal government asking them if we could expand upon that PEMA. But I just want to put one mention in the other crisis that I'm hearing from our providers is meth. And I just feel that right now, as a state or as a Commonwealth, we're very unprepared to deal with that crisis, just as we were unprepared to deal with the heroin crisis, and it's really going to ramp up here and become a huge health issue. Thank you.